Dear customer, you have just received your new Nemos therapy device for transcutaneous vagus nerve stimulation. Transcutaneous vagus nerve stimulation with Nemos is a gentle, patient-friendly option for the treatment of drug-resistant epilepsy. In this video, we'd like to show you how to use Nemos correctly. Please note that this video is designed to give you handling tips, but it is no substitute for reading the instructions for use. You can carry out your therapy with Nemos autonomously. The recommended daily stimulation dose is 4 hours, which should be spread evenly over several therapy sessions throughout the day. Each stimulation session should last for at least 1 hour. You could schedule a treatment session, for example, when you get up in the morning, again after lunch, during the afternoon, and in the evening before you go to bed. The important thing is that treatment time adds up to 4 hours per day. You can regulate the daily stimulation dose as required or even exceed it, for example, before a seizure. Let's take a look first of all at the individual components. Your pack contains the Nemos stimulation unit, an ear electrode including a cable clip for holding the electrode in place, and a set of small, medium and large silicone rings. Instructions for use, a charger, a lanyard and a storage box. Before you can use Nemos for the first time, you need to connect the device to the mains using the charger. The so-called first initialization begins. Nemos now turns itself on. Please allow the device to charge until the message "Battery fully charged" appears. Before you insert the ear electrode and begin treatment, you must clean your ear and the ear electrode before each session. This is absolutely essential. Use standard alcohol swabs for cleaning. You can buy these at any pharmacy. Clean your left outer ear, paying particular attention to the part above the opening of the auditory canal. This is where stimulation will later take place. Then clean the ear electrode, especially the 2 silver electrode heads. Use a fresh alcohol swab for this. Please wait until the cleaned areas are completely dry. This can take between 3 and 5 minutes. Please do not wipe these areas dry. When ear and ear electrode are dry, you can adjust the ear electrode to fit your ear. First of all, connect the ear electrode to Nemos. The cable must point to the left. The plug clicks into place. The first time you use Nemos, one of the silicone rings supplied must be fixed at the earplug. Try out which one fits your ear best and feels most comfortable. Now adjust the distance between the earplug and the electrode heads until the ear electrode sits correctly inside the ear. To do this, hold the ear electrode firmly by the electrode carrier and slide the earplug up or down to increase or decrease the gap. Insert the ear electrode like an earphone. The electrode heads must be positioned at precisely the place you cleaned earlier. When doing this for the first time, use a mirror or ask someone to help you. If the ear electrode is not positioned correctly in the ear, adjust the distance again or try using a different silicone ring. Depending on the shape of the ear, it is sometimes helpful to push the ear electrode up to the lower edge of the cartilage. Do not press too hard, however, so as to avoid causing pain. Switch Nemos on by keeping the on-off button pressed for approximately 2 seconds. You can now begin with stimulation. Stimulation consists of on and off phases. This program ensures that the brain does not become accustomed to the stimulus, thereby maintaining the stimulation effect. In the on phase, stimulation is active. Electrical impulses are transmitted. In the off phase, stimulation is interrupted. Both phases last for the same amount of time. The time until the end of the off phase is counted down in seconds. The stimulation intensity is displayed in milliampere. You can adjust the intensity yourself by pressing the navigation buttons. Pressing the up arrow increases stimulation intensity. Pressing the down arrow reduces it. Please note that you can only regulate stimulation intensity during the on phase. To guarantee optimum stimulation, please set stimulation intensity so that you can feel a tingling or pulsating sensation at the stimulation site. Stimulation should always be clearly noticeable, but not painful or unpleasant. Since sensitivity can vary from day to day and even during treatment, you should check every now and again whether you can still detect a tingling sensation during the on phase. If not, please adjust stimulation intensity accordingly. Nemos has a key lock function which serves to prevent the accidental adjustment of stimulation intensity. You can deactivate the key lock by pressing the right-hand function button. When the message "Deactivate key lock" appears, confirm with yes. To let you monitor how long you have already stimulated the nerve on a particular day, there's a bar in the top left-hand corner of the display. During stimulation, the bar is green and indicates progress in relation to the 4-hour daily stimulation dose. Underneath it, you can see the time remaining until the daily stimulation dose is reached. Once this is the case, the duration indicator stops at 0 and the bar remains unchanged. Occasionally, the ear electrode can lose contact with the skin, or the skin resistance is too high to allow optimum stimulation to continue. Nemos sends the message, "Please check position of ear electrode," accompanied by an acoustic signal. In this case, please proceed as follows. First of all, check whether the ear electrode is in the correct position. If after 2 or 3 unsuccessful attempts the message is still displayed, please stop stimulation. You may have to deactivate the key lock to do this. Wait 5 to 10 minutes without further adjusting the position of the electrode, then restart stimulation. If the contact is still not ideal, please clean your ear and the ear electrode once again. If you are unable to establish optimum contact, even after several attempts, please contact the appropriate service center. If stimulation causes you discomfort, please check stimulation intensity. Is it perhaps too high? Please also check the position of the ear electrode. Is it pressing too hard on the ear? Finally, please check whether the skin is intact in the area where the electrode is positioned. The electrode should not be positioned on areas of sore or diseased skin. If you are still unable to adjust stimulation correctly, contact the appropriate service center. We wish you every success with your treatment with Nemos. Please do not hesitate to contact the appropriate service center should you have any questions.